Emotionally, it's tremendous stress on me.
It's difficult for all of us. It's difficult for me to see my mom having to deal with what she has to deal with and feeling like my hands are tied many times.
Caregivers for Alzheimer's patients can find the task daunting.
The caregiver is responsible for the health and safety of another individual, but many caregivers report that caregiving is even more difficult than raising a child, because in many cases they're giving care to an adult that they're used to seeing be fully functioning. Their mother, father, grandparent, or other relation that they're used to looking up to as the source of wisdom, advice, etc.
It's preparing, all the meals and snacks and making sure that he's showered and brushes his teeth, and because, they forget to do these things. These are just normal everyday things that they've done their whole lives, and now you have to tell them to do it because they don't remember.
All right, take me.
Now a day center called COPSA, or Comprehensive Services on Aging, has come to the rescue. They provide cognitive and physical functioning for the patient and a respite of support for family members.
So they're very relieved, they feel very reassured that their loved one is left in safe hands, that there are professionals leading all of the activities, and the professionals are trained to help elicit responses from people who maybe can't generate responses or initiate independent activity anymore.
As important, the benefits from this are to my mom, where she gets some relief during the day. So when he's here Monday through Friday, which he is, it just gives my mother a little bit of a break.
If a caregiver never gets a break, they're going to burn out much faster. If they're getting a break a few times a week, they'll be able to care for their loved one at home for a longer period of time and keep them out of a nursing home for a longer period.
There is a social toll as well.
We get invited less and less to events that our group of friends used to have, picnics and dinners together and just day outings together, that we don't get invited to anymore.
Some of them, even their family members, don't even contact them anymore because they feel very uncomfortable being around them and talking with them.
For the caregiver, there can't be enough education and supports. For example, a lot of programs like ours offer support groups, so that in addition to the actual services, caregivers can talk to other caregivers and relate and exchange ideas and support each other. This has been invaluable to many caregivers because they need that additional emotional support to get through what can be an overwhelming task.